Bismillahirrahmanirrahim. The abnormalities of the growth hormone secretions are discussed in this video. One abnormality of the growth hormone is secretion is panhypopituitarism. This is the decreased secretion of all anterior pituitary gland. If we imagine this pituitary gland as the central power station with multiple glowing cables that are leading towards many target organs. Many target organs are connected by these glowing cables. So this is the normal function. What happens in panhypopituitarism? This station is darkened and crumbled, and all the cables are either disconnected or flickering weakly, symbolizing reduced hormone output. For example, a tumor in acquired or in late ages may result in the compression of the pituitary gland and result in the loss of connection or loss of connection with these all the organs because of reduced secretion. This panhypopituitarism may be congenital or acquired. The causes of panhypopituitarism in adults are craniopharyngioma and chromophobe tumor. Both of these are tumorous condition, while the third is the uh, pituitary blood vessel thrombosis that occurs in some women. That in these women there is occurrence of circulatory shock after the birth of a child. So this result in hypothyroidism and decreased glucocorticoid production, and also gonadotropins are decreased as a result of these panhypopituitarism. So the patient is lethargic person due to lack of thyroid hormone, who is gaining weight because of lack of fat mobilization by the growth adrenocortical and thyroid hormone, and lost all the sexual function. This condition is treated satisfactorily by the administration of the adrenocortical and thyroid hormone, while abnormal sexual functions are not treated. Visualize the anterior pituitary gland as the powerful central grid control room for the body's hormonal system. The power station is surrounded by dark clouds or collapsed beams, symbolizing tumor compression such as craniopharyngioma or chromophobe tumor, or vascular failure such as thrombosis that occur in postpartum females. The broken pipeline run toward three major destinations: the dimmed sluggish thyroid plant labeled hypothyroidism, a drained adrenal facility, barely running with flickering lights labeled low glucocorticoids, a shut down reproductive factory with a closed sign symbolizing the lost sexual function. So this person in the scene, the patient, is a tired, slouched human figure representing a patient wearing a heavy coat symbolizing the weight gain, and this person appears lethargic, yawning, or moving slowly, holding a dim light button and this light bulb over the head for mental fog, and a crossed out heart here is depicting the dim romantic symbol for sexual dysfunction. So here you can see that the thyroid hormone and adrenal hormone therapy can provide some restoration of the function, lighting up parts of the system, but the reproductive system remains off. The panhypopituitarism during childhood result in dwarfism. The body growth is decreased, but the organs, all the body parts, they are proportionately grown. So a 10-year-old child looks like a 4 to 5-year-old boy, or a 20-year-old may looks like about 7 to 10-year-old person. So the person that has got these panhypopituitarism do not pass through puberty. However, one third of these they have got selective growth hormone deficiency, so they may mature sexually. And the African pygmies and the Levi-Laurent dwarfism is a specific type where there is a hereditary inability to form somatomedin C or insulin-like growth factor. So in this dwarfism, the growth hormone deficiency will result in slow growth, decreased sexual development, and this can be corrected by thyroid and adrenal hormone therapy. So this concept can be reinforced by the analogy of a that growth train that never reaches the final station, and the train in this scene is a whimsical train station that is labeled as growth station with a sign that says destiny is full maturity. The train represents the child's development. It has small proportional cars symbolizing balanced body parts, but the is weak, engine is weak, moving very slowly along the track. The front of the train has a label low growth or panhypopituitarism, and the power sources are missing or weak. See, the puberty fuel here, it is not linked with it. It is not linked with it, so it is missing or disconnected. Somatomedin C tank is empty. It is empty. It is rusted, leaking for some type of dwarf like pygmies or Levi-Laurent dwarf, and the child passenger inside the train carries look younger than their age. For example, the 10-year-old is written but looks like only a 5-year-old child. Some cars have signs like body proportions are normal, slow track ahead, and one third of the train cars representing individuals with only growth hormone deficiency, selective growth hormone deficiency, are labeled can reach puberty and glow slightly brighter. A faded billboard on the side says, "No pit, stop at puberty station." So, gonadotropic hormone unavailable. The growth hormone is specific for species. So it is a species specific hormone, and the growth hormone from animals, except for some primates, is ineffective in humans. Hence, the name human growth hormone is used to specify the effective hormone for humans. Human growth hormone was previously extracted from human pituitary gland, making it difficult to obtain, limited in availability, and used only experimentally in past. But after the biotechnological advancement, recombinant DNA technology enabled the synthesis of human growth hormone in Escherichia coli, and now human growth hormone is mass produced, clinically available, and it is reliable for therapy, and it is effective for treating dwarfism due to pure growth hormone deficiency. So early treatment will result in full correction of the growth failure, and there are many potential broader application of these hormones. They may benefit other metabolic disorders due to growth hormone wide-ranging effect on protein, fat, and carbohydrate metabolism. Gigantism is a result of excessive growth hormone in childhood, and it results due to overproduction of the growth hormone due to hyperactive acidophilic cells that are present in anterior pituitary, hyperactive acidophilic cells, and the pituitary or these can be result of pituitary tumor, often the acidophilic adenomas. They cause increased secretion of growth hormone and result in growth of all body tissues. So if it occurs before the adolescence, that means before the closure of the epiphyseal plate. So before the closure of the epiphyseal plate, the long bone growth is still possible. So it results in increase in height. So height can go up to 8 feet. So these individuals uh, are called giants. The rapid growth of all body tissue results in extreme height, about 8 feet. There is hyperglycemia due to metabolic effect of the growth hormone. The pancreas is overactive, that results in eventual exhaustion of the beta cells, and this lead to diabetes mellitus in 10% of the cases. The complications may occur, such as panhypopituitarism, can occur later as the tumor grows and destroys the entire pituitary, lead to multiple hormone deficiencies, often cause early death if untreated. So treatment options are microsurgical tumor removal and radiation therapy that targets the pituitary gland. So acromegaly is the result of excessive growth hormone that occur after adolescence. The cause is acidophil tumor in the anterior pituitary that result in excessive growth hormone secretion that occur after epiphyseal plate closure. So bones no longer lengthen, but there is effect on bone and soft tissue effect. So bone overgrowth occurs, but it is not lengthening. It starts thickening, and head and feet bones enlarge. These bones are coarse, such as hand and feet size increases and may go up to 14 plus size of the shoes. The facial bone also affected. There is protruding jaw, mandibular overgrowth, and enlarged nose up to twice normal size, boosting of the frontal region of the forehead. and supraorbital ridges occurs. Vertebrae also overgrow, and these overgrowth of the vertebrae causes kyphosis or hunched back, and soft tissue overgrowth also occur. There is enlargement of the tongue, liver, and kidney. So the key clinical signs are coarse facial features, enlarged hands and feet, widened feet, hunched posture, and organomegaly. So this condition, acromegaly, occurs post-adolescence, unlike gigantism, which happens before the bone growth stops. So result is a once normal human growing sideways like a tree trunk, not taller but thicker. The hands oversized, shoes bursting, vertebrae twisted into a hunched arch, facial bones like exaggerated sculpting. So here in this picture, the character appears broad and stocky, not tall, emphasizing thickening rather than lengthening of the bone. The face is exaggerated with a large protruding jaw. There is mandibular prognathism, bulging brow, the eyebrow is bulging, and frontal bossing is also there. An enlarged, widened nose, hand and feet are oversized also, suggesting the need for extra large shoes and gloves. The fingers in these patients are also thick and sausage-like, highlighting typical features. Back is hunched from the vertebral overgrowth, and there is also soft tissue enlargement that lead to enlarging tongue visible from the mouth, suggesting macroglossia. And then there is organomegaly also, like kidney and liver may enlarge. So there is some established role of growth hormone secretion deficiency or decreased growth hormone secretion in aging. So declining growth hormone secretion with age may contribute to many physical signs of aging, and aging effect related to low growth hormone is associated with decreased protein deposition, and as a result muscle is dystrophied and skin wrinkling also occur, and increased fat deposition also occurs with the diminished organ function and or weakened strength and decreased energy level of the person. For example, a 50-year-old with long-term growth hormone deficiency may appear 65-year-old. So growth hormone replacement in elderly has got some pros and cons, and there are potential benefits in some studies, like there is increased muscle protein synthesis, decreased fat mass or fat deposits in the body, and enhanced energy and vitality. However, there are some adverse effects also, and noted in some studies. There is insulin resistance and diabetes, and development of edema, carpal tunnel syndrome, and various joint pains. So clinically, this growth hormone substitution is not routinely recommended for healthy elderly individuals, and it is reserved only for diagnosed growth hormone deficiencies with clear clinical indications. Thank you for watching this video. If you have any query, please write in the comment box.